Parents with children under immunizable age go in dilemma as COVID-19 second wave hits hard in Uganda, leaving many mothers in balance to choose between missing the immunization schedule for their children to control the most common childhood diseases or risk the exposure to COVID-19 in hospitals where the numbers tend to increase day by day. At Mbarara Regional Hospital, a hospital that admits patients from different districts of Western region and neighboring countries like Kenya, Tanzania and DRC, they have registered a total of 11 cases of immunizable children suffering from COVID-19, of whom 4 have died.
We have admitted 11 children. Of the 11, we have lost 4, which is very high. 2 of those had other problems. One came in with complicated malaria, but also had jaundice. Had COVID. And then the other one had another serious form of disease called sepsis.
Dilemma as children miss out on their vaccine doses due to mothers' fear of being exposed to the virus. At least each of the 3 districts, Mbarara District, Rampara and Mbarara City, that were visited in western Uganda, each registered many children of immunizable age with COVID-19 and worrying reduction of numbers of children brought to health facilities for immunization. Dr. Elias Kumbakumba, a pediatrician and deputy head of hospitals and university joint task force, and also senior lecturer at Mbarara University of Science and Technology, MUST, identified a lack of transport due to recent lockdown and fear of contracting COVID-19 as key factors threatening mothers from taking their children to hospital.
The biggest reduction was because of the restrictions in transport. When there was still restriction in transport, the numbers reduced because many mothers couldn't come to health facilities. Just like for many other services, even for HIV care, even for diabetic care, all the patients reduced. But we saw that the immunization clinic which I talked about earlier in MCH, that the numbers reduced. We used to see about 60, 70 mothers a day. We started seeing 15 to 20 mothers. Why? Because of lack of access.
It all depends at the facility, but at least we had a drop down of about 75%. Drop down. For example, if you had been registering 100 mothers a day, you could find that now we are only attending to around 25. So that was a very, very high reduction, or a trajectory, like kind of a very big drop down of people, both in antenatal, routine immunization, outpatient department, even deliveries. Mothers were refusing to come to deliver from facilities because of the fear and also of the guidance and the standard operating procedures which are not being used by the community.
During the first week of the lockdown, mothers kind of did come, but later in the second week, mothers continued coming. Up to now, they've been coming, and the turn up has not really changed.
Immaculate Shomkama, a mother from Bugamba in Rampara district, is among the mothers affected by the disruption caused by COVID-19, failing to meet the routine immunization visit for her 1.5-year-old baby.
In 19th July, I was supposed to come here on 20th July, June. Now I have come here to immunize my child with 1 year and 1 month.
So you missed that time?
I missed that time because of transport.
Lockdown age, we had.
Since the lockdown, we would go to local council chairman and get to move, but transport means were letting us down, though we managed.
Mothers said there are many mothers who have remained afraid of taking their children for routine vaccination at health centers, fearing that they and their children might be infected with COVID-19. Those who made it went through struggle walking on foot.
COVID-19 was everywhere. In the hospitals, it was worse. I could not risk my baby to the congestion in the hospital when even doctors were getting infected with COVID-19.
Worsened the situation, increasing fear that not maintaining routine childhood immunization might lead to more deaths among children resulting from the killer diseases like measles, diphtheria and polio.
Because immunization is really very important. When your children are immunized, we prevent all the other infections that can come in if these babies are not immunized.
The condition is also not sparing health workers who are also fearing for their life since they are handling children who by their nature cannot put on masks that are brought by their mothers to hospital when some of them have got infected with COVID-19.
Health workers are not really transmitting COVID to children, to patients. Why? Because we protect ourselves as much. Instead, it is the patients that are transmitting COVID mainly to health workers. Because when you come in, sometimes I don't know who has COVID or not before I test you. And before I do, sometimes you are interacted to the point that I may get COVID. But a lot of the health workers are actually doing their best to prevent transmission to the patients.
By the time we gathered this information, Mbarara Hospital had so far lost 4 children to COVID-19 out of the 11 cases registered in the second wave.
The cause of death was not the treatment. The treatment is, there are protocols we follow for children, or guidelines we follow for children, and they are largely safe. Even when they get very severely ill, their treatments we follow and they are largely safe. The problem itself is the disease itself, or the other diseases that are there when COVID comes in.
He assured mothers not to fear health facilities, saying health workers are not transmitting. Regarding the children who missed out their schedule, Dr. Kumba explains that there is no risk with that, encouraging mothers to catch up with the dose they have missed.
The problem is not that mothers are fearing really to come. It was mainly that they didn't have access.
Elsewhere in Chiruhura district, the district health officer said the district is doing well after seeing mothers fearing hospitals. They empowered the village health teams to carry on with the exercise reaching mothers from their homes.
So, for us, lockdown or no lockdown, our administration coverage is the same. It's about the way we set system. Now, other districts where you get this kind of challenges, I believe it's because sometimes the implementation is parallel. Now, when there's a lockdown and partners cannot enter the district, are you getting? Then people cannot work. But me, my approach and DHT, our approach is the district that leads the implementation. So even if there is a lockdown and partners are not accessing the district, implementation, as long as we are there, the DHT, and we guide this staff, immunization takes place. For us, we have not been affected.
Grace said that at the health facility, they ensure all SOPs are followed right from the main entrances of the health facilities to the end point where the children are immunized.
Like I said, we encourage soaps right from outside that gate. We have some gardens where all our patients come. It's a big area. We make sure there is social distancing as they wait. And we have a health educator who goes every morning and keeps interacting with them, giving them more information about the standard operating procedures, especially related to COVID-19.
Reassurance is that mothers can protect their children from COVID-19 by breastfeeding them more often, but doctors emphasized a mother must apply infection prevention control measures like putting on a mask and washing their hands frequently.
Apply what we call infection prevention measures, or infection prevention control measures. Why? Because we know that masks can prevent transmission of the child. So the mother should have a mask on as long as they're breastfeeding or they're close to the child. 2, the mother should be able to wash her hands frequently enough. So that every time you're going to breastfeed, you wash your hands. Every time you're going to touch the baby, wash hands and keep your mask on. 3 is even then babies, once if they are not breastfeeding actively, they should be at a distance from the mother a lot of the time, so that you reduce that close contact all the time.
He also explained that after breastfeeding, a baby should be kept a distance from the mother. He warned that failure to breastfeed poses a big danger to the child because it puts the child at risk of suffering from malnutrition.
So when you remove that breastfeeding, you cut off many things, and children then end up getting more serious problems than they would have got even if they contracted COVID. But also we are saying that there are ways of controlling infection of the child with COVID if the mother is positive. That's what we should be emphasizing, that a breastfeeding mother should continue to breastfeed, but be able to do practices that prevent transmission of COVID to the child.
Note that the funding source of the work produced here was made possible by One IFRA Women in News Social Impact Reporting Initiative. We recognize that the content produced reflects the author's views and not those of the funders.